Hi everyone, how are you doing today? I'm excited to be back on another episode of Dr. Sumner's Summit to Wellness. Excited to have you here. How's it going? Let me know how you've been doing. Really excited to be back on our next live airing. So join me, invite your friends, invite your loved ones. I'm excited to have you guys today. For those of you who might not know me yet, I am Dr. Felicia Sumner. I am your board certified family medicine physician and wellness strategist. I am dedicated to empowering you and your communities to become well, whole, energized, and loving life. I currently do this through speaking engagements, telemedicine services, and online coaching services. I also need to just remind you briefly of a disclaimer that as much as I really enjoy helping you by informing you on topics related to your health and wellness, this is not medical advice. This is for informational purposes only. So if you have any specific questions related to your individual diagnosis or treatment plan, then please discuss them with your doctor. And if I'm not your doctor and you'd like me to be, then please message me or click my Book Me link on Facebook or my website, drfsumner.com, and I'd be happy to get you set up for an appointment. I currently see patients in the states of Georgia and Pennsylvania online, and it would be my pleasure to see you. Okay, so thanks so much for joining, guys. I'm excited to have you all here. So now that all of that is out of the way, the lovely intros and disclaimers, if you're watching, please comment and say hello, or if you're catching the replay later, type in #replay. I'd love to know if you're here. So today we're going to talk about the top 10 screening tests that every woman should have. I took a poll just a few days ago. I went to see my primary care doctor for an annual checkup, or as I like to call them, check-in, and afterwards I randomly decided to take a poll on Instagram to see how many of you guys have had your annual checkup in the last year or 12 months. Guess how many of you had a checkup in the last year? Any guesses? Well, let me tell you, less than 35% of you guys. What is up with that? That's a bit insane. So in honor of Women's History Month, I figured let's discuss something related to the ladies today. So when you go to see your primary care doctor for a checkup, which I hope will now be very soon now that I'm reminding you, then these are the things that I'd recommend you keep in mind as preventive screenings that should happen for every woman. So we'll briefly discuss 10 of those tests today, and then I'd like to leave some time for a live Q&A for any topic. It's totally free game related to women's health. So think of some questions while you're watching and have them ready for afterwards. I'd like to try my very best to answer them because I believe knowledge is power. And without knowledge about your own health, it's not fair for us as doctors to assume that you can take good care of yourself at home, even with Dr. Google on board, okay? So the reason I wanted to talk about these things is because screening tests are really there so we can detect diseases or illnesses that are often what we call asymptomatic. That means conditions where you may not even feel any symptoms, but they could be seriously affecting your body. For example, a lot of cancers, they may be growing in someone's body well before they even have any symptoms. So that's why we have things available like pap smears, mammograms, PSAs, etc., to screen for these things before they get to the point of metastases or affecting other organs. So when you detect a disease early, you can prevent a lot of potential complications and even improve the length and quality of your life. So these tests, they aren't just for fun. They really make a big difference, and in many cases, they can even save some lives. So let's get started. Hi, Lazarus. Thanks for joining. Hi, Janice. Thanks for joining. Hi, PM. Good to have you all here. So definitely tag your friends, share with your loved ones, your family, especially the woman in your life that you care about, because these are definitely things I suggest you bring up to your doctor at your next appointment, your next checkup or check-in. So name for me any of the tests that you think are important when it comes to screening for women. Just jot them down, type them in below. Let me know what tests you think are common screening tests for women, what's important when it comes to screening for women, and we'll see if I talk about any of them in my top 10 today, okay? So what screenings do you think you should be getting if you're a female, okay? So let's get started. Number 1 is blood pressure. The American Heart Association says that if your blood pressure is below 120/80, you should have it checked at least once every 2 years. So even if your blood pressure is normal, you should have it checked at least once every 2 years, starting at age 20. And for adults 40 or older, or African Americans, or for those with conditions like obesity that puts them at increased risk for high blood pressure, the United States Preventative Task Force, also known as the USPSTF, that's a mouthful, right? They recommend an annual screening, so once a year. Hi, Sharon, thanks for joining. Number 2 is a cholesterol check. The recommendation currently is if you're 20 or older, you should have your cholesterol measured at least once every 5 years. If you're at risk of heart disease, though, like if you have high blood pressure, diabetes, you're obese, you have a family history or heart attack or a family history of stroke, then it should be yearly, once a year. And we spoke in another live video, if you might recall, about what I think you should really have screened. So not just your average lipid panel, but really what's called an NMR profile or a cardio IQ test, which gives you a much more in-depth and helpful answers about your risk of heart disease, okay? So cholesterol is number 2. Hi, Edith, thanks for joining. Number 3 is pap smears. These are the screening tests for cervical cancer, beginning at age 21 and until age 65. You should have a pap smear every 3 years. If you're 30 or older, you can have the test every 5 years. If you combine it with a screen for what's called HPV, human papillomavirus, which is an STD that can lead to cervical cancer. If that HPV test is negative and your pap smear is normal and you're 30 or older, you can have a PAPS every 5 years. I can count on more than both hands how many people thought that they need a PAP every year, but that's really just not the case. The guidelines changed a number of years ago because research shows that cervical cancer just doesn't grow that quickly for you to be screened so often, especially if you don't have HPV. So also please keep in mind that just because you've had a pelvic exam, it does not mean you've had a pap smear. They're very different, even though they may feel the same to you. So ask your doctor if you're having a pap smear done just to be sure. And really, you should always ask for the results of your test for your own records. That way you know. So there's absolutely no harm in that. And the more you know about what's going on with your body, the better you can advocate for and take care of yourself. Oh, and one more thing, even if you were sexually active before 21 years old, there is no reason to have a pap smear done sooner. Studies show that at that age, our cells wipe away the HPV, the virus that tends to cause cervical cancer, and wipes away those precancerous cells quite easily. So there might be an exception if you have a history of cervical cancer in your family, but for the most part, you should not have a pap smear until you are 21 years old. And in most cases, you can stop having them after age 65. So kudos to you for those who have hit that mark. Number 4 are mammograms. These are the approved screening tests for breast cancer. For those of you who have had the joy of getting this test done, I'm sure you'll admit that it's not the most comfortable, but it's the best studied test we have available right now. This test is performed by placing your breast on a flat surface, and by using compression, we take X-ray images of your breast. So there's some concern, though, that due to the radiation that you do get from breast cancer, from the mammograms, and the number of false positive, which means that you could be diagnosed with breast cancer when you really don't have it, there's been some debate about when and how often you should have a mammogram done. So some boards and societies, they start at age 40, and others say age 50. And some say get them done every year, whereas others recommend every 2 years. So I know it's super confusing, and with all of this lovely confusion as a doctor, my recommendation and my conclusion is this: I start to have the conversation with my female patients starting at age 40, but I don't really push it until age 50 if you're not having any symptoms and if there's no family history of breast cancer. And in most cases, unless there's some history of an abnormal finding on previous mammograms, I do space my patients' mammograms out to every 2 years. A lot of studies support this, and I don't really want to subject my patients to unnecessary pain and radiation. Really, and unfortunately, actually, the data is not phenomenal when it comes to mammograms. That's why I don't have people do it more than they have to. For those of you who may not be aware, studies show that 84 women need to be screened annually between 40 and 84 years old to save one life from breast cancer. And even though mammograms may lead to an earlier breast cancer diagnosis and they do improve survival rates from breast cancer, they don't improve mortality or death rates. So some of you may have heard actually of another option for breast cancer screening called the thermography, breast thermography. Have any of you heard of that before? Let me know. Hi, Jill. Thanks for joining. Hey, Kalani. Thanks for joining, Dr. Kalani. There is some promise with breast thermography, but there's a lot of pitfalls that's going on too. So this is a way with thermography to detect breast cancer and other breast abnormalities with a heat infrared picture. So we detect the amount of heat that the cells in your breast are giving off. So there's really good news. There's no pain associated with it, and there's absolutely no radiation exposure associated with it. And it does detect more than just cancers, though. So it often still ends up leading to a mammogram anyways to clarify what's really going on. And there's also a major issue with insurance coverage. So in most cases, it's not covered by insurance. So with all of that being said, mammograms are still the best thing we have available right now for breast cancer screening. And I do recommend you get it done, especially if you have a risk of breast cancer at all. And that includes if you're overweight, if you have a family or a personal history of breast cancer, if you're a smoker, and there's a number of other things. There's even some studies to suggest that if your vitamin D levels are low, then you could be at increased risk for breast cancer. So basically, I'd recommend if you're 40 years old, then begin to have a conversation with your doctor about the right time to begin screening for you and how often. Okay, so number 4, mammograms. Now on to number 5, bone density test. Women should start getting screened for osteoporosis with a bone density test at age 65. So those with risk factors for osteoporosis, which is thinning of the bones that can lead to bone fractures. The risk factors include a history of fracture or a low body weight, like a low BMI level. Those people should be screened earlier. But for this test, it's called a DEXA scan, DEXA scan. If someone can type that in the comments for me, go right ahead. Hi, Bessie. Thanks for joining. Hi, Abby. Thanks for joining us. With the DEXA scan, you lie on a table while a low-dose X-ray machine, it captures the images of your bones. And it depends on what your test results are as to how often you need to get this test done. So that's number 5, a DEXA scan, a screening for osteoporosis. Number 6 of the top 10 screening tests I would recommend for every woman is a screening for diabetes. That's starting around age 40. Women should get a blood sugar test at least every 3 years to check for diabetes or pre-diabetes. And this can be done with just a fasting sugar, or what we call a glucose test, a draw in your blood, or even a finger prick if you're fasting, or with an A1C, which is a blood draw, which measures how your blood sugar has been for the past 3 months. You don't have to fast for this test. If you are obese or you have a family history of diabetes, or if you're African American, which also puts you at an increased risk, it is recommended that you may want to start earlier than 40 and get screened more often. So your doctor can help you figure out the best time for you, but for many people at risk, I often screen as early as age 18, but typically at age 30 for most of my patients. Number 7, hi Nina, thanks for joining, is colon cancer screening. So this month, in case you didn't know, is Colon Cancer Awareness Month. March is Colon Cancer Awareness Month. So screening for colon cancer is quite important. For the majority of the female population, you should start screening at age 50, according to the USPSTF. This can be done with a colonoscopy or a sigmoidoscopy, and that's when we have a lighted tube and a camera that's inserted into your anus to examine your lower colon for a sigmoidoscopy, or the entire colon for a colonoscopy. There is also a stool test that is not invasive, like the test I just mentioned, that's quite accurate at detecting colon cancer as well, but this has to be repeated every single year, whereas if you get a sigmoidoscopy and it's normal, that's every 5 years, and a colonoscopy, if that's normal, that's every 10 years, okay? Also worth mentioning, the age for screening is 50 years old for most people. However, a number of studies have shown that due to African Americans being diagnosed with more aggressive colon cancers and dying earlier and quicker from colon cancer, it's actually recommended that they are screened starting at 45 years old, and it is covered by insurance at that age for African Americans. Number 8 screening test is lung cancer screening. A lot of us docs often forget this one because it's a bit of a newer recommendation, but the USPSTF recommends annual screening for lung cancer with low-dose CAT scan, a low-dose CT, in adults aged 55 to 80 years old who have a 30-pack year smoking history. So that means you've been smoking an average of a pack a year of cigarettes for the past 30 years. Or you might be smoking 2 packs of cigarettes a year for 15 years. So do the math, 30-pack year, that's how we calculate it. And you currently smoke, or you have quit smoking in the past 15 years. So if your age is 55 to 80, and you have a 30-pack year smoking history, and you currently smoke or you've quit in the last 15 years, you should have a lung cancer screening with a low-dose CAT scan. Number 9 is a skin exam. Women should examine their own skin every month at home, and I recommend having a yearly in-office skin exam where you're completely derobed. If you want to share this, I would love to hear it. When was the last time you went to your doctor's office and you were seen from head to toe for a skin exam, whether it's at your primary care doctor or a dermatologist? It is important, and it's a recommendation. If I'm not mistaken, it's a category B, which means that for the most part, most experts agree this could be included during your annual checkup, or you can do it with your primary care doctor or dermatologist, okay? And skin cancers, especially melanomas, which are the most dangerous of them all, they can hide in odd places, like between your toes or behind your ears. So it's really important to get a thorough skin exam and be screened for skin cancer. Last thing is a dental checkup. You might not think that I'd mention this as a doctor. We shouldn't pay that much attention to teeth, but your dental health can play a major role in your overall health. So it's very important to maintain dental checkups twice a year. All right, so those are the top 10 screening tests I recommend every woman have in order to continue to take charge of their health. To recap, we talked about getting your blood pressure and your cholesterol checked starting at age 20, a pap smear starting at age 21 and up to age 65, especially if they've been normal. We've discussed mammograms. You should begin the conversation with your doctor at age 40, but I typically won't begin screening until age 50 and every 2 years unless there's risk factors. We talked about the screening test for osteoporosis, the bone density or DEXA test, which is recommended for ages 65 and older. We also mentioned a screening for diabetes and prediabetes. And depending on your risk factor, that could be as early as 18 or as late as 40 years old. So you should have a conversation with your doctor. Then we talked about colon cancer, which is recommended to start at age 45 if you're African American or age 50 otherwise. And lung cancer screening to begin at age 55 if you've been smoking an average of 1 pack a day for the past 30 years. We also talked about the importance of derobing and getting a complete skin exam and a dental checkup at least once a year. And a dental checkup. So that was 10. All right, so what questions do you have? Was this information helpful for you? Did you learn anything new? Please comment below and let me know what you think. And I'd like to stay on for a few minutes more for a live Q&A as promised on anything related to women's health, no holds bar. So what questions do you have, if any? Let me hear it. I'll stay on for a couple more minutes. And if you haven't joined our Facebook group, the Be Well, Whole, Energized, and Loving Life group, I'd love to have you there because this is where I share more free insight related to health and wellness topics and answer your questions in hopes to get you and your communities healthier. So if you're feeling tired or you're in pain or you're suffering from feel like crap FLC syndrome, or you've gone from doctor to doctor without any clear answers for your symptoms, or you're tired of taking so many medications and want to know the right way to finally get off of them, or you're trying to find the right plan to lose weight without the confusion of scouring the internet and getting unsolicited advice from your friends, or especially if you're a woman, a mother, a wife, a busy entrepreneur or professional, and you just need support to stay on track for the sake of your and your family's health, then this group is for you, okay? So join me there. I'll post the link below. So let me see, are there any questions before I go? Pam said she never had a skin exam at the doctor. Okay, so definitely mention it the next time you are seen. I think it's uber important. African Americans are actually diagnosed with melanoma at an unfortunate, more aggressive rate, meaning, I'm sorry, not at a more aggressive stage by the time they're diagnosed, because it tends to be in spots, like I said, between the toes or places that aren't easily detected. So it is important to have a skin exam, a routine skin exam with your doctor. All right, so any other questions, let me know. I will hang out for a little bit more, but I'm really excited. I do hope that this was helpful for you. I'm going to post the link for the Be Well Facebook group for those of you who haven't joined. I think that it's super helpful, a great support group for all of you who are on the journey to be well, because I think that without a community, it's tough if you don't have the support to help you along the way. And I'm there to help hold your hand, but there's a bunch of other folks that are on there with the same goals at mind. So I'm excited to have you guys join me. All right, so last chance. I'm going to have a little bit of a countdown. Last chance to ask me any questions related to women's health, or if you want to message me, that's fine too. But again, I'm really excited to have you all here. I do hope that this was helpful information. All right. Well, if there are no more questions, I will see you guys next time. And until then, be well. I'm hoping to have a session where I'm just going to do a live Q&A, so I'll give you guys a heads up about that when that happens, so you can have your questions prepared, because I really believe that knowledge is power, and I want you to be able to empower yourselves to gain the best of what your body is capable of doing. So be well, guys. Be whole, energized, and loving life. And I hope to see you on our Facebook group. Okay, take care and have a great day. Have a great night.